That moment when you notice more hairs on the pillow in the morning, or when the bathroom light seems to reveal a more apparent scalp than before. For millions of men, these are the first signs of a process that generates deep anxiety. Male baldness, or in medical terms androgenetic alopecia. As a medical specialist in the field, I can affirm that hair loss is one of the most common concerns and one that most affects a man's self-esteem. In a world saturated with magic formulas and miraculous promises, it is crucial to separate myth from science. The good news is that, today, we perfectly understand the causes of baldness and have an arsenal of treatments with proven effectiveness. If you are starting to notice the first signs or have been living with baldness for some time, this complete guide will provide the necessary clarity for you to make the best decisions for your hair health. The first signs: how does male baldness manifest? Androgenetic alopecia rarely happens overnight. It is a gradual process of hair miniaturization, and recognizing the signs early is the most important step for successful treatment. Pay attention to the famous receding temples. The most classic sign is the recession of the hairline at the temples, forming an M. Thinning at the vertex, crown hair loss on the back of the head, popularly known as the monk's crown, is another very common indicator. Decrease in overall density. You may notice that the hair as a whole is thinner with less volume. A ponytail gets thinner, or the scalp becomes more visible under light. Finer and shorter hairs. The miniaturization process causes healthy, thick hairs to be progressively replaced by finer, shorter and fragile hairs, almost like peach fuzz. Increased daily shedding. Although it is normal to lose up to 100 hairs per day, a noticeable increase in this shedding in the shower, on the brush, or on the pillow can be a warning sign. The real cause: genetics and the DHT hormone. It's time to demystify. Male baldness is not caused by wearing a hat, washing your hair every day, or by stress, although stress can cause other types of temporary hair loss. The cause of androgenetic alopecia is a combination of two main factors. Genetic predisposition. Yes, heredity is largely to blame. If you have cases of baldness in your family, whether on the maternal or paternal side, your chance of developing it is significantly higher. Action of the DHT hormone. This is the protagonist of the process. Our body converts a part of testosterone into a more potent hormone called dihydrotestosterone, DHT. In men with a genetic predisposition, the hair follicles on the top of the head are sensitive to DHT. The hormone binds to these follicles and initiates a process that causes them to shrink, miniaturization. Over time, the follicle becomes so small that it can no longer produce a visible hair shaft. It is important to note that the hair on the nape, back of the neck, and sides of the head do not have this genetic sensitivity to DHT, which is why in most cases, men retain hair in these areas. Treatments that provenly work. Here we enter the field of evidence-based medicine. Before starting any treatment, a consultation with a dermatologist is indispensable for a correct diagnosis and an individualized treatment plan. The main approaches are: 1. Clinical treatments to stop loss and thicken hairs. Topical minoxidil. This is a lotion applied directly to the scalp. Its function is to increase blood flow to the follicles, prolonging the hair's growth phase. It does not block the action of DHT, but it helps to revitalize miniaturized follicles, thickening existing hairs and slowing the progression of baldness. It requires continuous use. Finasteride and dutasteride, oral use. These are medications that act directly on the cause of the problem. They inhibit the enzyme 5-alpha reductase that converts testosterone into DHT. By reducing DHT levels in the scalp, they can stop the miniaturization process and in many cases, reverse some of the loss, resulting in thicker, denser hair. They are prescription drugs and must be used under strict medical supervision. 2. In-office procedures. MMP, microinfusion of medication into the skin using a device with microneedles. The doctor injects medications like minoxidil and finasteride directly into the scalp, enhancing their absorption and results. Low-level laser therapy, LLT laser helmets and headbands can be used to biostimulate the follicles, improving cellular metabolism and encouraging the growth of stronger hair. 3. The solution for already bald areas, the hair transplant. When baldness has already left areas completely without hair, no clinical treatment will make new hairs grow there. For these cases, the most effective and definitive solution is the hair transplant. The modern technique, such as FUE follicular unit extraction, consists of removing one by one the follicles from the donor area, nape and sides, which are resistant to DHT and implanting them in the bald area. As the transplanted hair maintains its original genetics, it will no longer fall out. It is a meticulous surgical procedure that, when well executed, offers extremely natural and permanent results. Male baldness is a medical condition with well-defined causes and, fortunately, with a range of effective treatments. Ignoring the first signs and believing in miraculous solutions is the path to frustration. The most powerful step you can take is to seek guidance from a dermatologist. The sooner you start an appropriate treatment, the greater the chances of preserving your hair and, in many cases, recovering lost density. Taking care of your hair health is taking care of your image and your well-being. Science is on your side.